All right, good morning, everyone. We are going to get started. Welcome to the New Hampshire Insurance Department's 2023 annual hearing. Before we begin this morning, I would like to take a moment of prayer, silence, and reflection for our neighbors in Maine who suffered a horrific and unthinkable tragedy this week. Thank you. As most of you know, my name is DJ Betancourt, and this is my 7th annual hearing. However, it is my first with the of having the great honor and privilege of being the commissioner of this great department. My team has worked incredibly hard to put together a very informative program with some outstanding speakers. I would like to take a moment to recognize some key members of that team. Dr. Jason Azes, the director, of our health economics. Alex Feldavel is here. His technical title is Health Reform Instructor, but that title is wholly inadequate for what Alex provides to our department. Andrew Demers, our Communications Director. AJ Kierstead, our Outreach Coordinator / Tech Guru, I believe is the technical term for that. And then Morgan Harris, the Director of Healthcare Analytics. Throughout today's program, we will, of course, fulfill our statutory obligation to explain what we see as healthcare cost drivers and its impact on premiums in New Hampshire, and to foster a public forum for the public, all of you who have joined us today, to provide feedback and ask questions. Spoiler alert, I get to do this. I'm the commissioner. New Hampshire continues to have favorable premiums, especially when compared to other states across the nation. In fact, they remain among the lowest in the country. However, we will also address some key priorities, both of mine as commissioner, but also those that have been long-standing to the department. For example, you will see expanded data about the condition of our small group market, which was one of my key focuses. You will see continued success of our state's 1332 reinsurance waiver, which this department championed from the outset and for which my team can take great credit. And finally, we have decided to dedicate the second half of today's program to a long-term commitment of this department to promote and advance price transparency in healthcare, which we believe is a vital tool to empowering consumers, supporting market reforms, and controlling costs. We did get a few inquiries about some other topics, one in particular being mental health parity. As I have mentioned on several occasions, making New Hampshire the gold standard for mental health parity is a deep and personal commitment, as well as other issues. But for today, this important topic and many others are outside of the scope of the presentation. However, I can assure those of you who are interested in those topics that they will be the focus of many conversations over the course of the next year and beyond, and I look forward to working with all of you on these critical issues going forward. Finally, as commissioner, I am a staunch believer in collaboration. I want all of you to know that my door is always open to all stakeholders who possess a passion to improve the lives of Granite Staters, and I encourage you to take advantage of that offer. With that said, I would like to now turn the presentation over to Dr. Azes to run through the logistics of the program and introduce some of our guests.
Good morning. I'd like to thank Commissioner Betancourt for his thoughtful remarks, and I echo them. I'd also like to acknowledge Jason Dexter, our Life and Health Director. He was pivotal in all of the planning for this important event. So there's that. And I'd also like to acknowledge the other NHID staff here who are great supporters of all the great work that we do. Okay, so I'd like to briefly address some of the housekeeping items before we get started with this great presentation. I think you'll like it and you'll learn a lot from it, as I did. So today's event is being recorded. It'll be available later on YouTube and on the NHID website. Any attendees that are on Teams are muted to preserve the audio quality. During and after the presentation by Jen Smagula from Oliver Wyman, remote participants can use the chat function to submit their questions. Dawn Gorman will be fielding those questions and asking them at the end of the presentation. Live attendees here can raise their hand with questions during the Q&A period after Jen's done presenting. If you have comments but not a question, please wait until the public comment after the entire hearing. We've sent those who've registered a hearing link to the preliminary report. This report, as well as a 2-page quick fact sheet, is available on our website. For easy access, we've also included QR codes on the back of the agenda. A final report will be published on the NHID website in early December. Following the presentation, as DJ said, we'll have a short break for refreshments and then followed by 3 price transparency expert presentations. I think you'll learn a lot from them. So now, without further ado, it's time to introduce Jen Smagula, presenting findings from the data submitted to the department. Jen?
Thank you, everyone. I'm Jen Smagula. I'm a healthcare actuary with Oliver Wyman Actuarial Consulting. I'm joined today in person with my colleagues Dawn Gorman and Linda Keene, and virtually with my colleague Michael Pedre. And I'm going to take you through the presentation on the key findings from our 2022 preliminary report on New Hampshire's healthcare premium and claim cost drivers. So the goal of the report and presentation is to examine health insurer premium and claim cost drivers and the factors contributing to changes in these costs. So this year's focus is on 2022, but we also have some early information from 2023. So different this year, I thought I'd start with what the key findings are so that you can be more aware of which items to focus on as I go through the presentation. And we'll also review these again at the end of the presentation. So some key findings. First off, the individual market has experienced some significant increases in enrollment starting in 2021, but we'll see that continue into 2022 and even further into 2023. So this is driven by several factors, including New Hampshire's state-based reinsurance program, which started in 2021, all the additional subsidies that came through as a result of the American Rescue Plan Act and were continued under the Inflation Reduction Act, and then ongoing changes that are occurring with Medicaid eligibility redetermination. Now, small group enrollment has continued to decline, but that decline has been slower than what we saw a couple years ago. The small group enrollment is now less than what we're seeing in the individual market. Now, from a medical expense perspective, the trends in the fully insured market from 2021 to 2022 have been pretty much flat. And when we look at the trends on a 3-year annualized basis, so more of an average over 3 years from 2019 to 2022, we're seeing those trends lower than what we were seeing prior to COVID. Pharmacy trends continue to be driven by specialty pharmacy, inpatient and outpatient facility, and professional provider payment rate changes or unit cost changes are higher in 2023 than what we've seen in the past. And then lastly, insurer risk margins are higher in 2022 than what we saw last year. So these first couple slides try to give an overview of how New Hampshire compares to other states in the region and also the US average for some key metrics. So this first slide is showing the uninsured rate in New Hampshire. So the uninsured rate is that bright green line in the middle. So we're seeing a decrease in the uninsured rate. It was at 6.3% in 2019. It dropped to 5.1 in 2021, and then it decreased a little bit more into 2022 at 4.9. Now, the United States average uninsured rate is that dashed bright blue line up top. They also have seen a decrease. It was at 9.2%. Up in 2019, and it's dropped to 8% in 2022. And this chart also shows uninsured rates for the other New England states. So when comparing New Hampshire to other New England states, New Hampshire's uninsured rate is slightly above the median in 2022, with Massachusetts having the lowest uninsured rate and Maine having the highest when you look across all the New England states. Now, this slide gives an overview, some directional information about where New Hampshire residents are receiving their health insurance in 2022. And this is based on information from the American Community Survey. So as we saw in the previous slide, the uninsured rate in New Hampshire is around 4.9%. So that's that bright green piece of the pie. So of the approximately 1.379 million residents in New Hampshire, this translates to about 68,000 residents in New Hampshire not currently having health insurance. Approximately 61% of residents in New Hampshire receive their insurance through either the private commercial market, so that's that big dark blue piece of the pie, or they're purchasing coverage on their own, so that's that light gray piece of the pie at 6.7. And after the employer coverage category and the individual coverage category, the next biggest categories are the Medicaid market, the dark gray, and the Medicare market in that bright blue. So these next couple slides compare New Hampshire's average premium to the average premium in other New England states and the US average. This first slide looks at the individual market using publicly available information from the CMS risk adjustment reports. Average premiums in the individual market decreased about 15% from 2020 to 2021, and then they remained fairly flat from 2021 to 2022. Now that decrease from 2020 to 2021, again, is driven by that new state-based reinsurance program that started that year. Now, across the United States, that bright blue line, the changes in the average premiums have been fairly flat over the past couple years. And when comparing New Hampshire to the average in New England, the New England average is that gray line. New Hampshire's individual market premiums of about $453 PMPM are about 25% lower than the New England average. And when looking at the rank of the individual market premiums by state, New Hampshire is the third lowest. Now, there are going to be differences by state. So, for example, New Hampshire's actuarial value, which measures benefit richness, that's actually pretty consistent, New Hampshire versus the New England average. But New Hampshire's risk scores, which measure morbidity, New Hampshire has slightly lower risk scores than compared to the New England average. So this next slide looks at now that same information, but for the small group market. New Hampshire's small group market premiums, which is the dark blue bars again, has remained close to the United States average in 2022. The US average is the bright blue line. And average premiums in New Hampshire in the small group market increased about 3%. Versus about in the US, they've been increasing about 4% from 2021 to 2022. Now, the New England average, which is that gray line, they've also increased roughly the same, about 3%, but you can see they're at a higher level. The New Hampshire premiums continue to be lower than the New England average, and they're about 9% lower in 2022. And then similarly, when we rank all the data and you're looking across all the states, New Hampshire's somewhere in the middle. New Hampshire's about the 21st highest in the small group market when you rank all the states. This last slide in this section now compares large group average single premiums in New Hampshire to the US and New England states. So the CMS risk adjustment doesn't apply to the large group market, so we don't have that same data available to us that we did on the other slides. So here we're using survey data from the Medical Expenditure Panel Survey. And here you can see the United States average is actually lower. That's that dashed blue line. And New Hampshire is the bright green line in the middle. And the other New England states are the other colors. So this shows that in the large group market, New Hampshire has higher average premiums than the US average. And when compared to other New England states. Their position has fluctuated over time, but as of 2022, they're among the lower of the New England states, along with Massachusetts, shown in the dark gray. All right, so now we're going to move on to some information related to coverage shifts and enrollment. So here in this first slide in this section, we're looking at health insurance enrollment by market segment, by insurer. We'll look at by insurer in subsequent slides. So this first slide gives an overview of New Hampshire's CITUS commercial insurance market from 2019 to 2022. And by New Hampshire CITUS, we mean that New Hampshire has jurisdiction over the policy, which in turn typically means that the employer is headquartered in New Hampshire. And by commercial, we mean people who purchase insurance on their own or they receive coverage through a New Hampshire employer. So on the left-hand side, the gray bar shows the proportion of membership within each commercial market segment in 2022. So similar to prior years, approximately 88% of commercial coverage is purchased through employer-sponsored insurance or ESI. So this consists of the small group market, the large group fully insured market, and then lastly, the large group self-insured market. So note that over half of the commercial market, or 54%, are part of large self-insured groups. Now, the right-hand side in color shows average enrollment by market segment for each of the past 4 calendar years. And looking at the top, which starts with the individual market, we can see the number of individual market members has increased significantly from 2020 to 2021, and then further into 2022, where they added an additional 4,000 members. So we're going to take a closer look at what's driving all this in some of the subsequent slides. Now, the small group market has continued to decline, but you can see that it's slowing down in the more recent period. The large group fully insured and the large group self-insured segments have both experienced decreases in enrollment. And when you look at this overall, compared to last year, there has been a slight decrease in the overall commercial enrollment, and they're currently at about 488,000 members. So these next 2 slides give some insight into how there's been some market shifts as far as which insurers are covering these members. So this is the small group market, and it's showing the insurer distribution for 2020 versus 2022. Now, in prior years, we had seen that Tufts Health Freedom Plan, which is shown in the light gray, had increased their market significantly. But now that we're looking into 2022, we can see that they are losing market share. So they've went from 19% to 8% in 2022. So note that as of January 1st, 2021, United Healthcare owns the Tufts Health Freedom Plan, and it's been renamed to United Healthcare Freedom Plan. So we'll use both those names going forward. And during the same time, Anthem Matthew Thornton, which is in dark blue, has significantly increased their market share. They went from 38% down to 55%. And then Harvard Pilgrim they've lost a little bit, but they've stayed fairly consistent. And then this slide is now for the individual market. So Ambetter in the bright green has continued to increase their market share. They had very little presence when they first entered, and we looked at this back in 2017, but they've grown significantly. So they're at 27% market share in 2020, and they've grown to 41% in 2022. And at the same time, Anthem Matthew Thornton has lost some market share. They're currently at 50%. And then again, Harvard Pilgrim, they've lost a little bit, but they've stayed fairly stable. These first couple slides we looked at was all enrollment information through 2022, but we do have some early 2023 enrollment information. So this slide takes a deeper look at enrollment for April 2022 to April 2023, and it's just for the fully insured segment. So overall enrollment has been fairly steady. Overall, we're seeing 225,000 as of April 2022. That dropped slightly to 221,000 in April of 2023. But you can see some of the, there's some shifting that's happening. The individual market has continued to grow. They gained another 3,000 members during this time frame. The small group market just decreased slightly, but then we are seeing decreases in the large group insured market, so that dark blue piece of the pie. And in talking to the carriers, a couple of them did note that they've seen within their own business, they've seen shifts from employer groups moving from insured to a self-insured status. So this slide takes a more long-term view of enrollment for the individual and small group markets. So through the annual hearing data collection process, membership is now collected as of April, July, and December of each year, and each dot on this chart represents a data point. The small group market is shown in bright blue, and the individual market is shown in dark blue. So between April of 2018 up until very recently, July of 2023, small group enrollment has declined about 13%. They've lost about 9,000 members during this time frame. Now, the individual market, which is the dark blue, you can see their membership patterns are more volatile. And what we had typically been seeing is that there are typically decreases throughout the year. So they start at a certain level at the beginning of the year, and then they lose enrollment throughout the year. But starting in 2021, this did not happen, and we've continued to see increases. And there's several things driving this, which I alluded to earlier. So one is the New Hampshire state-based reinsurance program. Again, that started on 2021. That brought significant decreases in premium to the individual market. So you can see that in 2021, that is bringing in more members. Excuse me. Secondly, also in 2021 and continuing is the additional subsidies through the American Rescue Plan Act. So that act, not only did it expand subsidies for those who already qualified, it brought additional people into the market who qualified for subsidies. And the Inflation Reduction Act has continued those subsidies through 2025. And lastly, we've also seen some special extended enrollment periods. So it just, people have been given more time to enroll further into the year. So that's driving a lot of the increases you're seeing in 2021 into 2022. But then we also are seeing this increase into 2023. So we're currently at 66,000 members in the individual market as of July. So in addition to all the expanded subsidies and the reinsurance program, New Hampshire has restarted their Medicaid eligibility determination in April of 2023. So that is most likely contributing to this additional increase we're seeing going into 2023. So for the first time in April of 2023, enrollment in the individual market is now actually higher than what we're seeing in the small group market. Now, we did ask the carriers, for those carriers who participate in both the individual and small group market, if they had seen any shift among their own business between small group and individual. And they did note, while they did see some shifts, so maybe some small group members moving to the individual market, it really wasn't a key driver of what's happening. So this slide now goes one step further and takes that individual market and breaks it into 4 categories. So the first category being the dark blue, the non-exchange. So these are folks that are part of the ACA market. They're purchasing off exchange directly through the insurers. And it also includes the grandfathered transitional enrollees. So as of 2022, there were still about 2,000 people in that population. That program has ended at the end of 2022. So now those folks will presumably shift into ACA products within the individual market. And then the bright blue line, those are folks who are purchasing on the exchange, but they are not eligible for subsidies. We have the light gray line, which are exchange enrollees who have above 250% of the FPL. So those folks are eligible for advanced premium tax credits or APTC. And then lastly, we have the dark gray line. So these are also exchange enrollees, but they're between 138 and 250% of FPL. So they're eligible for both the APTC credits and the cost sharing reduction. So we've already brought this up a couple times, but the New Hampshire state-based reinsurance program, which started in 2021 and really lowered premiums for that segment significantly. That seems to be what's driving the increases in enrollment that we're seeing in the dark blue and the light blue, because these are folks who are, they don't receive any types of premium subsidies. So they're paying the full premium for their products. So they're most benefited by this reinsurance program. And you see enrollment in those segments increasing. And then the light gray and the dark gray line. So these are folks on exchange who are eligible for subsidies. You see their enrollment also increasing into 2021 and further into 2022. So, I mean, they're also benefiting from the reinsurance program. But on top of that, these are the ones who received additional subsidies through ARPA and the Inflation Reduction Act. And then lastly, again, when we look at our most recent time period, so the April 2023 and the July 2023, we see the light gray and the dark gray line. The light gray in particular spike up even more, and that most likely is driven by the Medicaid redeterminations that are happening as people are rolling off of Medicaid and no longer eligible. They are potentially entering this individual exchange population. So consistent with the information we just looked at on the individual and small group markets, now we're looking at the large group. So the fully insured segment is in bright blue on the bottom, and the self-insured segment is in dark blue on the top. Now, the self-insured segment, you can see it's shown we've got some small increases, some small decreases, but over this 4-year time frame, enrollment has only decreased fairly slightly. So they've lost about 5,000 enrollees from the beginning to the end of this time period. So that's just about 2%. Now, the large group fully insured segment on the bottom, they've experienced a more gradual but in slight declines over this time period. They've lost about 14,000 members, or 13% of the enrollment. So as I mentioned previously, some carriers that participate in these segments did point us to, they are seeing some of their own groups have moved from an insured status to a self-insured status. And then one carrier did note they, within the self-insured segment, they're seeing some of their accounts grow, so adding employees. So this last slide on enrollment looks at a couple different things. So the table up top, this is total commercial situs enrollment. And this is a combination of all the segments we've been talking about. So the individual, small group, large group insured, large group self-insured, it's all combined. And then the bottom box is showing, it's showing 2 lines for the Medicaid population. So the light blue is the standard Medicaid population, and the gray line is the Medicaid expansion population, or the Granite Advantage program. And then the dashed dark blue line on the bottom is the individual market. So the individual market, the dashed line is a subset of the commercial population up above. So here we can see from, starting around April of 2020 at the time of the start of the pandemic to December of 2022, we've seen commercial enrollment in Hampshire decrease slightly, but it's been fairly stable, while the Medicaid enrollment has been increasing during that time. Now, this is reversed. So starting in April 2023, again, when Medicaid enrollment has started to decrease as a result of the redeterminations starting up again. And at the same time, while that's happening, we've seen the commercial market grow slightly, and then in particular, in the individual market. So now these next couple slides look at medal levels for the 3 most recent years we have available. So 2021, 2022, and 2023. And a medal level represents a plan's actuarial value or benefit richness. So how rich the benefits are. So generally, bronze plans are going to have lower premiums with higher cost sharing, while silver and gold plans are going to have higher premiums but less cost sharing. So this first slide is showing medal level distribution for the individual market exchange. And there we're seeing a shift away from bronze plans to mostly richer gold plans, and to a little extent some the silver plans as well. So from 2021 to 2023, the percentage of enrollees in gold plans increased 8 percentage points. So from that top light gray bar, the 10% to the 18%. And now this is most likely due to both the reinsurance program that started in 2021, which lowered premiums and allowed people to buy up to more richer plans, but also as a result of the ARPA subsidies, because again, people that were eligible for subsidies are getting more subsidies and are able to purchase a richer plan for a similar amount of money. This slide now looks at the same distribution or the same type of data, but for the non-exchange markets. So even there, we are seeing a very sizable shift away from these less rich bronze plans and towards the richer gold plans. And then lastly, in the small group market, the same type of data. But here we really haven't seen any type of shift over time. It's been fairly steady as far as the medal levels that the small group market is purchasing. But one thing interesting to note, you can see in the small group market, they're much more skewed or heavily weighted towards silver and gold plans and not very many bronze plans. That's very different than what you see in the individual market, where there's a lot of people buying these, the less rich bronze plans. Okay, so now we're going to turn our attention to what's been happening with premiums in New Hampshire over the last couple years. So the premiums shown in these slides, they include both the employer and the employee portion of a premium in the group market, and the individual market data that we're showing, this is prior to any subsidies being taken into account. So the average fully insured premium, PMPM, in New Hampshire increased 3.2% from 2021 to 2022, so that the number is shown way over to the right. Now, when you look at the information by segment, the individual market saw a slightly lower increase in premium. Their premiums only went up about 1.3%, and the small group and large group markets saw slightly higher average premiums at like 3.4 and 5.1% respectively. And as you can see, average premium levels in the individual market continue to be lower than what we're seeing in the group market. So the premium trends that we're seeing here are more in line with what we have seen in this market when we go back and look pre-COVID. So when we look pre-COVID from like 17, 18, and 19, we were seeing group market premiums in like the 3 to 6% increase range. So these are in line with what we were seeing there. And the other data that we're looking at for many of these slides is what's shown up top. So an annualized trend from 2019 to 2022. So this represents an average, really a 3-year average over this time period of what we're seeing with trends. So when you look at the data that way, you can see in the individual market, their 3-year average premium rate change is minus 4.8, again, driven by the reinsurance program that started back in 2021. And then the average for the small group and the large group markets are in that 3 to 3.5% range. This chart looks at the change in the second lowest cost silver plan in the individual market from 2019 to 2023. So rates and rate changes for the second lowest cost silver are commonly reported, as this is the plan that represents the benchmark plan from which those federal premium subsidies or the APTCs are calculated. So it's a very common benchmark that is looked at. But it is important to keep in mind this is only one plan, only one rate, and the insurer offering the second lowest costing silver can change from year to year. The plan itself can change from year to year. But when looking at this, we can see when just look the second lowest cost silver, we see that big decrease again that we've talked about many times, going from 2020 to 2021, driven by the reinsurance program start. We see that premium continue to decrease into 2022. Some of that is most likely just the continued benefit of the reinsurance program. And then when we look into 2023, we see the increase for the second lowest cost silver has gone up 4.7%. So that increase is a little more in line with what you might typically see due to trend. So the premiums shown in all the previous slides are before any APTC subsidies are taken into account. But now this slide gives an illustrative example of what a 40-year-old non-tobacco single policyholder in New Hampshire would pay for a second lowest cost silver plan, which is the bright blue, and then also for a median bronze plan. So as explained previously, ARPA, and then later under the Inflation Reduction Act, those subsidies were increased in 2021. So both the people that were already getting subsidies got more subsidies. And then for the people who weren't eligible, now some of them are eligible for subsidies. So the 323 in the bright blue, that's the full premium for the second lowest cost silver. The dark blue, the 315 is the full premium for a median bronze plan in 2023. So when you look over to the far left, these are the folks at the lower income levels. So they're paying, after you take into account all the subsidies and depending on their income level, they're paying anywhere from $0 up to $68 for a bronze plan per month. And then if they're purchasing the second lowest cost silver, they're paying anywhere from $0 to $76 in premium. So now we also wanted to give a sense of what we just showed was all the premium that is being paid for these health insurance products, but members are also responsible for cost sharing with these products, so deductibles, co-insurance, and co-pays. So this gives a sense of the value of all the cost sharing that they're paying and how that's changed over time. And then the boxes up top, that gives a sense of, as a percent of total medical expense, how much the members are responsible for through the cost sharing that they need to pay. So when looking from 2021 to 2022, there actually hasn't really been a ton of change in how much members are paying out of pocket. Now, on the left-hand side, we have the individual CSR population. So these folks are paying some of the lowest cost sharing per month because, again, these are folks who are on the lower income scale who are eligible for those cost sharing reduction subsidies. In the middle, we see the individual non-CSR and the small group folks. So they're paying the most in cost sharing, anywhere from like that 114 to 117 per month. And then on the right-hand side, we see the large group fully insured and then the self-insured segment. So the self-insured segment's paying the least amount in cost sharing on average. Now here we're trying to, in this last slide in this section, we're pulling together information from the past couple slides and showing the relationship between the premiums that people are responsible for, but also the benefits that they're receiving and the richness of their benefits. So the paid to allowed ratio is on the Y or the vertical axis, and that's an indicator of how rich the health insurance benefit that they're receiving. So the higher the ratio, the richer the benefits and the less the members paying out of pocket. Now the X-axis or the horizontal axis is the average premium. And each bubble in this chart represents a different market segment. And the shaded circles are last year's values and the dark solid circles are this year's values. So you can see enrollees in the individual market who receive cost sharing reduction subsidies. So in the top half of the chart, they have some of the richest benefits because their paid to allowed ratios are fairly high and they're in the upper half of the chart. And by contrast, enrollees in the individual market who are not receiving subsidies, so the dark gray squares, they have the least rich benefits in the market because they're in the bottom half. And then if you set aside the individual CSR folks, because they're the ones receiving subsidies, and you look left to right, you can see that generally as benefit richness increases, your premiums are going to increase. And the large group segment off to the right, they have some of the richest benefits, but their premiums are also higher. Okay, so everything we looked at in that past section was all about premiums and cost sharing. So those are the costs that the employers or the consumers are incurring directly. And now we're turning our attention to claims and utilization, which is the actual experience that feeds into the premium development for the fully insured segment. Now, when we look back, trends in the market segments were negative for all segments when you look at 2019 into 2020, and that's all due to all the shutdowns that happened in 2020 and all the low utilization that happened in 2020. Now, in 2021, we see that the claims level spiked up significantly. So that's all the return to care that happened, the pent-up demand, the COVID treatment, the COVID vaccine administrations, and the COVID testing that occurred. And now we're getting our first look into 2022, and we can see that the claims levels were actually lower in 2022 than what we saw last year in the individual market, and they're fairly flat in the group markets. So but then when we look on the self-insured side, there is a small increase, about 4.6%. So knowing that 2020 was obviously a very unusual year due to COVID, and even 2021 is also considered an unusual year because of everything I just mentioned, return to care, all the COVID treatment that happened. So another metric that we've been looking at again is this up top, the annualized trend from 2019 to 2022, because that really represents an average. So when we look at that metric, we're seeing claims trends overall in the insured segment averaging about 2.1% over this time period. And in the self-insured side, we're seeing that average about 2.6. Now, when you go back and look at older reports and what was happening back in 17, 18, and 19, we were seeing annual trends at that point in the 4 to 6% range. So what we are seeing in the group markets in particular is still lower on average than what we were seeing when you look pre-COVID. So now this chart, these next couple charts takes a deeper dive into the group market trends in particular and breaks it out into different components. So this first chart, it takes the fee for service fully insured trend and it breaks it out into utilization and then unit cost and mix. So utilization is a measure of the number of services provided, and then unit cost and mix, it's a combination of the change in prices that are paid to providers or paid for drugs, and then any change in the mix of services or the mix of providers who are offering those services. So, you know, as shown, the impact of COVID-19 has continued to cause dramatic changes in trends, and obviously most in particular on the utilization side, because there you see, again, that big drop in 2020 when the shutdowns happened. You see the very large spike up in 2021. And then now that we're looking into 2022, we see actually a negative trend change, the 2.7. When we look at this over the average of 3 years, it's about 1.3%. Now on the cost and mix side off to the right, you can see there hasn't been nearly as much fluctuation as what we saw on the utilization side. The 2022 cost and mix trend is higher than what we've seen the past couple years. So that's at 3.3. And when you look at a 3-year average up top, it's running at 1.7. So, and then when you combine all this together on a PM basis, the average 3-year trend for fee for service claims is running at 3.1%. Now, as part of the annual hearing data collection process, insurers provide average unit price changes or payment rate changes for major service category levels for both current year and their projected year. So this chart is an aggregation of that data for the inpatient and outpatient facility combined, which is the dark blue, and then professional services, which is the light blue, and for the past couple years. So this is showing that across all reporting insurers in New Hampshire, average payment rate changes from 19 into 2020, 2021, and even into 2022. There was some fluctuation, but it was fairly stable. And now when we look into what's being projected for 2023, it does seem like there is an increase. So now we're running at an average of 4% increases on the inpatient facility side and 2.3% on the professional side. So multiple insurers did note to us that the rate changes that they're seeing on the hospital side for 2023 and then even beyond are some of the highest that they've seen in several years, and that hospitals are pointing to losses that they sustained during the pandemic and increased labor and supply costs as reasons for these rate changes being higher than what they've seen in the past. So we drilled into the utilization and unit cost part of the trend, and now this slide drills into trends by service category for the group markets. So similar to what we saw when we were looking at utilization trends, we're still seeing a ton of fluctuation in trends when we look at data by service category. So on the medical side, so we have the inpatient, outpatient, and then professional. So again, all these service categories saw fairly sizable decreases in 2020. They all saw big spike ups in 2021, the dark gray. And now there's a little bit more of a mixed bag when we look at the light gray data from 2022. So the inpatient trends are continuing to be negative. The outpatient has popped back up. It's at 3.6. And then professional is actually running fairly flat, slightly negative. Now, multiple insurers, when we were asking them about what was happening on the inpatient side, they did feel like a lot of this is driven by COVID. There were a ton of COVID-related admissions in 2021, but that has, significantly dropped in 2022. And then several insurers also cited just the increased shift that was happening before COVID, and it's continuing to happen, the shift from in the inpatient setting to the outpatient setting. Now, the lower outpatient and physician trends in 2022 that we're seeing compared to what we saw pre-COVID, they are citing things like there's just less COVID testing and vaccine administration that was happening. Now, when we turn our attention to pharmacy, we can see the pharmacy trends have been more stable except for 2020. But the interesting thing is that the 2020 pharmacy trends really, it wasn't a COVID impact for the most part. It's just that several insurers in New Hampshire coincidentally happened to have changed PBM contracts that year. So that was really the driver of what we're seeing in 2020. It's not COVID related. And then when you look at, looking at those data points up top, again, the average trends from 2019 to 2020, we can see, overall this 3-year period, outpatient and professional are running at about 4%, pharmacies running at 3.4%, and then inpatient, even looking at an average, their trends have stayed flat over this time period. So this slide takes that 3.1% average fee-for-service trend that we looked at a couple pages ago, and it breaks it out into which service categories are really driving that trend. So how much a service category drives a trend is going to be impacted by how big the category is, and then how much trend that category itself is changing. So here you can see that, what's really driving the 3.1. The biggest driver is outpatient facilities, because their outpatient facility costs and changes in those costs are driving almost half the trend. And again, this is a combination of both. Outpatient facility is just a big category. It represents those numbers down below, the 37% total of total medical expense. About 37% is outpatient facility. So it's just a big category. And then their overall average trends of 4% are one of the big drivers. And then it's followed by professional, pharmacy, and then to a very small extent, inpatient and other. And inpatient, again, even though it's a sizable category, it's about 15%, but because their trends are fairly flat, they're obviously not really a driver of trend. And I guess also to point out pharmacy, we talk a lot about pharmacy trends because they are a contributor, but because pharmacy itself is still, it's not as big of a category as outpatient and professional. So even though we are typically seeing high trends in that category, when you step back and look at overall what's driving things, pharmacy is a driver, but it's still not as big as some of these medical categories. Okay, so the next 2 slides, we are going to drill a little bit more into pharmacy. So all the bars on the left-hand side represent pharmacy costs that are covered under the pharmacy benefit, or part of what you might hear referred to as traditional pharmacy spend. And the percentages in the parentheses next to each of the categories represent how much that category represents of total traditional pharmacy spend. So overall, traditional pharmacy spend increased 5.7% from 2021 to 2022. And this comes after an 8.8% the prior year, and then that negative 4% the year before that. And when you look at the different categories, generic, brand, and then specialty, you can see specialty does generally have some of the highest trends. Now, specialty drugs are generally high-cost medications that treat complex and chronic health conditions, and they may require special handling. So specialty drugs can include things like chemotherapy, immunotherapy drugs. There are also drugs that treat HIV, multiple sclerosis, inflammatory conditions, hepatitis C, cystic fibrosis, just to give you a sense of what kind of drugs are in that category. Now, specialty drugs, they can show up on the traditional, under the traditional pharmacy benefit, like we're showing them on the left-hand side, but they can also show up on the medical benefit, which is what we're showing on the right-hand side. So if they're showing up on the right-hand side under the medical benefit, it generally means that they're being administered in a physician's office or in a hospital setting. So you can see that, turning back to the left-hand side on the traditional pharmacy, those specialty trends are generally running higher than what we're seeing on the generic and brand side. And they now comprise a larger and larger portion of overall pharmacy spend. When we looked at this back in 2019, specialty pharmacy represented about 47% of pharmacy spend, but now we're up to 56%. And turning our attention back to the right-hand side, those pharmacy that's coming through the medical benefit, the trends haven't been very large as of late. It's actually stayed pretty flat, that 45, 46 PMPM, but it's still a sizable category. And when you combine all this pharmacy data and you look at how much specialty is making up a pharmacy, both under the pharmacy and the medical benefit, all these specialty drugs account for about 69% of all the pharmacy spend that's happening. So throughout this report, all of our data being reported is net of prescription drug rebates. And rebates are amounts that are paid to insurers or PBMs from drug manufacturers, and it reduces pharmacy costs. So given all the changes that happened with some of the insurers with their PBM and the new rebate contracts that were cited by insurers back in 2020, we can see that pharmacy rebates grew fairly significantly from 2020 into 2021. And that's that middle set of bars. Those are the rebates themselves. So because rebates are growing at a faster rate than overall pharmacy spend, it is bringing down the pharmacy spend data once we look at it on a net basis. So when you look on the left-hand side, the pharmacy trends gross of rebates, we were seeing a 7.5% trend. But once you account for all the pharmacy rebates, that's where we get to that 5.7% trend that we saw in the previous slide. Now, about 56% of rebates were for specialty drugs in 2022. So that number is continuing to increase. So there's a lot of rebates typically for specialty drugs. So as the specialty drug bucket itself grows, the rebates, when we look at rebates, that number is also growing. Okay, so this bar graph compares the distribution of member months by our key segments, individual, small group, large group, and it segments members into their annual allowed claims costs. So for example, that first bar, the individual market, we saw that about 10.6% of members had no claims in 2022. About 37.8 had between $1 and $999 spend. So that's that bright blue, and then so forth. So when you look at this across, segments, we see there's not a ton of difference in those first couple bars. They're generally in line. And then as you start to get further up the chart, you start to see more of the differences. So, at the highest spend level, so those top three bars, we saw that about the individual market had 17.9% of their claimants with spend over $5,000, whereas the small group and large group market, they had closer to 21% in 2022. So the small group, large group market does seem to have more high cost claimants than what's happening on the individual side. And the other, interesting thing I think to point out that many of you probably know, but to see it in the data is that there's really a small number of people that are contributing a large amount of cost. So when you look at just these top 3 bars and you add up the percentages, again, we're talking about like 18 to 22% of the population is accounting for 80 to 85% of total costs. Now, insurers were asked to report on primary care PMPM spending by market segment for 2021 and 2022. And new this year, the definition of primary care was provided by the New Hampshire Insurance Department to ensure consistency in reporting this category among the insurers. So we did see increases in the primary care PMPMs from 2021 to 2022 for all segments. Overall, we saw about a 3.7% increase. And then the top line, that's looking at how much primary care represents of total medical spend. So in total across these segments, we see that's running about 6%. Now, I think we've talked about this in previous years, but there are several states including Rhode Island, Delaware, Oregon, Colorado, that have requirements related to primary care spending and specific targets. So some states like Rhode Island, they have a specific target set. Their target's at like 10.7% right now, and they've had a program in place since 2010. And then other states have targets where it has the percent of primary care spend has to increase by so much each year. So maybe like a percentage every year has to increase a percent. The last 2 slides in this section looks at some utilization data. It looks at by market segment, and then we're looking at 2 key utilization metrics. So this first one is inpatient admissions. So kind of like what we were talking about earlier, we saw decreases in the overall inpatient spend. And here you see it coming through when we just look at just the number of admissions themselves. So overall, inpatient admissions decreased from 2021 to 2022. We saw an overall decrease of 10.6%. When you look at on a 3-year average basis, the numbers up top, we see a decrease of 4.3%. I guess the other interesting thing to note is that across the board, the 2022 inpatient admission levels, the light gray bar, they're all lower than what we were seeing back in 2019 pre-COVID. Now for emergency department visits, which is what we're looking at here, we did see a dip going from 19 to 2020, most likely due to COVID. We saw that come back up in 2021. And then the 2022 levels are also running slightly higher than what they were in 2021. And when we look at an overall 3-year average across these segments, we see it running at like 0.6. So fairly flat on average. All right, the last section, these last couple slides are looking at from an insurer perspective, information related to risk adjustment and then medical loss ratios. So this slide shows risk adjustment payments by insurer for the past 4 years in the individual market. So in general, insurers who have healthier members are going to pay into the risk adjustment program. So you're seeing them show up in red, they're below the line. And then insurers who have sicker members are going to receive money and they're shown above the line or in the black and the white. So you can see there's the amount that has been distributed among the insurers has actually come down over time. There was about 17 million being distributed back in 19. And that's slowly decreased. We're running at about 12.5 when you look at the 2022 data. And the insurers who are generally paying or receiving hasn't changed over time. Like the Harvard Pilgrim, it's generally been receiving money, while the Matthew Thornton has been the major payer. This is now the small group market, so that same data. There's more insurance companies in the small group market, so there's just, the slide is more busy. There's more insurance companies. I think the other thing to note, you can see the amount of money changing hands is smaller in the small group market than in the individual market. There's 6.8 million being exchanged in 2022, which is, about half of what was exchanged in the individual market. And also, generally speaking, you see the carrier, while the amounts that they're either paying or receiving does change over time, it's generally the same carriers that are showing up as a payer and the same carriers showing up as a receiver. So with these last 3 slides, we're showing loss ratio information by market segment for 2021 and 2022. So this first slide is the individual market. Now, all this information is coming from the federal MLR reports, but this is not meant to replicate that federal MLR rebate calculation. It's just using that data to show what is happening year by year. So in the individual market, we saw that the risk margin, or the contribution to surplus, that light gray piece of the pie, it was 1% back in 2021, and now it's running at 7%. Now, when we look back over a longer time frame, if you go back and look at other reports from the past, the risk margin in the individual market has fluctuated fairly significantly. If you go back and look at 2017, it was a negative risk margin, and then it really jumped up in 18 and 19. It was over 10% those years. In 2021 and 2020, we saw, it came back down to this 1% level, and now we're seeing it come back up again. So I think part of this speaks to just all the volatility that's been happening in the individual market. So even outside of COVID, which caused a lot of volatility with pricing, it's just all the changes that have happened, all the different enrollment changes that are impacting the individual market. This next slide shows loss ratio information in the small group segment. So similarly, this is all coming from the federal MLR reports, but it's not meant to replicate that rebate calculation. The risk margin in the small group market, we also saw an increase. It went from 2 to 5%, so not as large of an increase as we saw on the individual side, but it is increasing. And then lastly, this is the large group market information. So we also saw an increase there from 2021 to 2022 in the risk margin of 2% to 6%. And, like in the individual market, we've seen a lot of fluctuation, and that risk margin, we haven't seen that on the group side. When you look at risk margins over a longer time frame, they're generally running in the 2 to 6% range. I guess the other, important piece of information to point out is that dark blue piece of the pie. So that represents of the premium what is actually being spent on medical claims. So in the large group market, it's running 85, 83%. Small group market slightly lower, 83 to 81, and then slightly lower in the individual market. Okay, so we are back at the key finding slides that I went over in the beginning. So I'm not gonna read through these again, but I'll just let you read through them on your own and digest them. But I think, as Jason had mentioned, these slides were all taken from the full preliminary report that is out on the NHID's website. So that has all these slides and even more, and just more context and commentary around what we have been seeing this year and compared to historical. I would like to thank all the NHID staff for all your assistance with this report this year, and also especially to all the New Hampshire insurers. I know many of you are here or probably listening, but thank you for all your assistance in collecting this information. And now I believe we have a short time for questions. Okay.
Hi, everybody. My name is Don Gorman of Oliver Wyman, and we got a few questions virtually from the presentation. I just wanted to go through them quickly. Two of them had to do with whether or not we provide the percentages of membership that have a certain deductible or not, and that is in the report. As Jen mentions, the preliminary version of the report is on the website, and it's not finalized yet, so take it with a grain of salt. But I wanted to direct people's attention. They were asking about different membership within different deductible levels. And we do have that information in the preliminary report. Page 78 and 79 have it for the last 3 years. And that's for small group and large group. And then we also have a chart in the appendix, chart page number 82, which has all of the membership by the different deductible levels, and it has it for all the markets. So for fully insured, you have an individual, small group and large group, and then total. And then also for self-insured, we have that as well. So just to answer the specific question that was asked about members above 3,000, it is about 34% of membership in the fully insured market has deductibles that are greater than 3,000. And then if they also want to look at it above 5,000, it was about 34%. So I think that answers that question. There's a lot of information in the appendix. The second set of questions had to do with MLR data. So Jen can probably speak to this a little bit more than I can, but one of the questions was, it seems like we have calendar year 2021 data in the report and 2022. And I think the way it's working is that the calendar year 2022 data is in the body of the report. And in the appendix, we had calendar year 2021. And then the other question regarding MLR was regarding before and after rebates. So can you talk a little bit about that? I mean, I can ask you the specific question if it's helpful, but basically they're asking about whether or not the MLRs are, do you have the information prior to the rebates for different market segments?
Yep, I think I kind of breezed over that, but yes, we in the individual market, there were rebates given in 2021 and also 2022. So I believe our report, I just didn't put it in the presentation, but there are slides that show what the MLR looks like prior to adjusting for rebates and then after adjusting for rebates. And all the slides I showed here are after adjusting for rebates, MLR rebates. So it does make a difference in the individual market. I don't remember the numbers off the top of my head, but you know, it does, when after you account for the rebates that the insurers are paying back to their consumers, it does bring down their risk margin. And in the small group and large group segment, there were MLR rebates paid. They're not quite as significant, so it doesn't make as much of a difference, but that information should all be in the report.
Thank you so very much. That was a great presentation. Thank you, Don. Thank you, Jen. We are going to take a short break to segue into the second half of the program. Before I do that, however, I wanted to introduce the other members of the department who are here. It occurs to me that in some circumstances, you might only know each other through a screen. So it might be a nice opportunity to have an in-person conversation. So I'm going to introduce them. One thing I will say, I'm still struggling to get everybody's title exactly correct. So if I accidentally demote anyone, don't worry about it. And if I accidentally promote anybody, we'll talk about that when we get back to the department. So first and foremost, Keith Nyan, formerly the head of our consumer division and our new deputy commissioner. So they often say that when somebody assumes a new role, they have big shoes to fill. I made sure that I left very small shoes for Keith to fill. Christy Rice is here with us, our assistant commissioner. Michelle Heaton is right behind her. She is the attorney for our life and health division. Maureen Belanger is here. She is the head of our life and health market conduct unit. She is joined by some members of her team, Gregory Arce, Teresa Finmore, Victoria Fowler is here. She is the forms guru. I think that probably is a promotion. Christy will have to get her a step increase. She is joined next to her by Karen McAllister, who is the market analysis examiner. I call her the queen of data. She does a great job. And then a very, very important person who's not in the room but is downstairs is a woman who needs no introduction, Sandra Barlow. She's been with the department about as long as I've been alive. I think I am her 18th commissioner or something of that nature. But let me assure you that whoever, regardless of the title that any of us holds, Sandra actually runs the place. So make sure you do say hello to her. So those are the members of the team. Please feel free to have a conversation with them. And we'll take a short break and we'll be back for the second half of the presentation. Thank you.